Hello, today I'm going to be talking about the cause of multiple sclerosis, and this would be part 5 in my series of the infections that cause multiple sclerosis. If we haven't met yet, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. And it has been such an amazing privilege to share this information with you because we have to go down a different path. If we want to recover from chronic disease, especially multiple sclerosis, then we have to treat the cause. And there is so much evidence supporting the cause of what truly is a cause of multiple sclerosis. And there are so many people recovering. We have to have discussions about this. So today we're going to be talking about the research and really I know that there's been a lot of pull towards thinking that viruses are a huge part of the cause of MS, but I'm going to be talking about some of the reasons of why I believe at this time that viruses, although they could be involved, they are not the main cause of multiple sclerosis. In part 1, I talked about filarial worms that Dr. Alan McDonald has been finding in the central nervous system of every single MS patient that he tested. Those are very small, tiny worms. And when these worms are present in the central nervous system of domestic animals, they have all the symptoms that are associated with multiple sclerosis. They get the extreme fatigue, they have balance issues, they have numbness and paralysis and difficulty or mobility issues and spasticity, the spastic gait, so many symptoms, all similar. And so what we found is helping our students to treat those nematodes has been incredibly helpful to help them recover so much quicker. Part 2, I showed you pictures of the parasites that our students are passing, and they are quite disgusting, but it really helps you to have a visual idea of what you're dealing with. And I'm going to be sharing some successes with you today of students that are right now on the track of treating all of these parasites and fungus, etc., and recovering. And I have hundreds of pictures of worms, but I just shared with you on part 2 just a few cleaned up worms so that you can really understand what we're dealing with. In our experience, what we've noticed is that when the students are passing the very large worms up to 2 feet long, it's not an immediate, well, sometimes it is, I should say, they're also passing little ones, and we don't know if the little ones or the big ones are making the big shifts in the neurological symptoms. But as they are passing the large worms, they're having significant improvements in their health too. And I believe that probably it's more the smaller nematodes and maybe protozoa, etc., that are causing more of the neurological symptoms. But if we're infested with large worms, they have to go. They infect us with so many other smaller parasites. So that was part 2. And then I talked about fungal overgrowth. And next week, I'm going to be sharing some highlights from the Roots of Toxicity conference that I was at this past last weekend. And it was wonderful to be amidst 600 to 700 integrative, medically trained dentists and doctors, and probably other physicians, or other practitioners, but most of them were MDs. And so I just want to share the highlights of that with you next week. But again, several of them were talking about mycotoxins, the toxins from fungi, and how deadly they are. They are some of the most toxic substances in the world. And when we have fungal overgrowth, it's not just the fungi, it's not just the fungal infection that is making us sick, but it's also the poisons that they're producing. So that was part 3 of the 5-part series. And then I talked about Lyme disease. And the key is that all of this is involved in chronic disease, especially when we're dealing with neurological diseases. Then the Lyme, the vector-borne infections associated with Lyme, are really common. And so we talked about that. And please, you need to go back and watch those videos if you haven't watched them, because they are so profound. And so many people have been sharing such huge aha moments when they've watched them. With Lyme, it's interesting that way back in 1911, they were already finding these spirochete corkscrew-shaped bacteria in the central nervous system of people that suffer with MS. 1911, that is a long time ago. So that is one of the common infections that we're dealing with when we have neurological diseases. Today we're going to talk about viruses, and it's not a huge topic, so it won't be a very long topic. If you have any questions, make sure to type the questions in. If I don't get to them all at this time, then we'll be answering them later on. And please, if you like these topics, like and subscribe. Whether you're in Facebook, make sure to like our Facebook, the video, and also share this with other people, because we have to get the word out. We really have to help people to understand what the cause is. And you guys are the troopers. You guys can help get the word out. All right. So with respect to viruses, there has been a lot of attention in trying to figure out if viruses are causing multiple sclerosis. And I honestly believe that the biggest factor about that is to develop vaccines, right? And that's the big thing with viruses, is they want to develop vaccines. According to the Multiple Sclerosis Society, to date, researchers have not been able to identify a single virus as a trigger for multiple sclerosis. And I honestly don't believe that they will. They are trying to link viruses such as Epstein-Barr virus or else the human herpesvirus to be causes of multiple sclerosis. But there's a few reasons why I really don't believe that they would be one of the main causes, one of the main infections that are causing all the neurological symptoms. When we have a suppressed immune system, viruses can be more active, absolutely. But does that mean that they're causing our disease, or does that just mean that they're kind of more active, like maybe we can get the flu more often, etc.? And that's what I truly believe, is that because we have such a large burden of, it's called dysbiosis, we're really out of balance, we have multiple infections, then the viruses can be more active for sure. We could be more susceptible to viruses being active, but I don't believe that they're the main cause. One of the viruses that have gained a lot of attention is the Epstein-Barr virus as far as causing multiple sclerosis. The Epstein-Barr virus, maybe you remember back in high school when there was a student that would come down with mono. Maybe you did. Be few students did, but there was always like one or two students that came down with mono. And, they suffered and they were tired and they didn't get to be in school often, etc. And it takes time. It takes time to get past that. So Epstein-Barr is associated with that. But what's interesting is that at least 92% of the population tests positive for Epstein-Barr virus. So almost the entire population tests positive for Epstein-Barr. Yet, in multiple sclerosis, they find it's a little higher. It's probably closer to 100%. But the problem about saying that Epstein-Barr virus would be causing MS is that if it was, and 92% of the population is infected with Epstein-Barr, then you would think, and it causes MS, then you would think that most of our population should have multiple sclerosis, and that is not the case. Viruses are not alive. They don't eat food. And whether you've watched my videos on YouTube and on Facebook where I talk about the Live Disease-Free Eating Plan, how we're going low carb and how that's giving people so much symptom improvement, or whether you've been a wellness champion in the academy, etc., you know that by decreasing the carbohydrates, that you start to see significant symptom improvements. So whatever is causing MS likes sugars and carbohydrates, and viruses are not living. That is a really, really important thing to understand. So that means that if we changed our diet and viruses caused multiple sclerosis, we would not see a difference in changing our diet, because the viruses don't care. They don't eat sugars. They don't eat carbohydrates. They would still make us sick. And we see really significant improvements. And I'm going to share a few successes of the students that just shared with me last night on our coaching call in the academy. And so the first step in recovery is always to stop feeding the infections that are making us disabled. And when we do that, we notice significant improvements. Why has there been so much interest in viruses, in trying to pinpoint that to be the cause of multiple sclerosis? And I honestly believe that they're looking for vaccines, for sure. Absolutely. And I honestly believe that is not going to help us. And I'm going to share with you These are real life people that are recovering, not just from multiple sclerosis, but from other diseases also. So this first student is on his at least second or third treatment cycle. And if we haven't met yet, what our students are doing is, number one, they stop feeding the infections following the Live Disease-Free Eating Plan. Then they support the body in various ways. They make sure they're sleeping. You can watch some of my videos on YouTube, Live Disease Free, or Facebook, Live Disease Free. So they are supporting their body by having daily bowel movements. They're sleeping at least 8 hours a night. They're looking at their blood work. They're supporting their physiology. They're cleaning up their environment. They're going through a checklist, and they're feeling better and better. They're still sick. They still have the infections, but they're ready to treat. And then once they're ready to treat, they get samples of the different treatments, and then they get tested to see, and it's through energy testing because we don't have good stool tests yet. And so they get tested to see which of the treatments are most helpful for the infections they're dealing with, the infections that they want to recover from, instead of trying to figure out which critters they have. And so once they do that, then they start treating. So they have to get a prescription because we're finding that the parasite drug treatments are so much more helpful than the herbs when you're recovering from chronic disease. So they will do at least 14 days of treating parasites. Sometimes if they test well for 5 parasite drugs, they might split it up. So they might do 14 for 2 or 3 and 14 for another 2 or 3 treatments. So 2 weeks up to a month of treating parasites. Then they will treat fungal overgrowth, and then they will take a break, and they'll cycle through. And so that's one cycle. So as I talk with these successes, you'll understand what I'm talking about. So this one gentleman is recovering from multiple sclerosis, and he shared, I'm passing a lot of worms, kind of gross, feeling better each day. My strength is coming back, and I've noticed a huge improvement in my endurance. My mental attitude is improving, finding it easier to perform larger paper projects like getting taxes ready. I feel that my symptoms are almost all gone. And so he still will have to treat a few more times, but he's getting close to being symptom-free, which is so amazing. And then the second student is, we have students that are treating and students that are joining us, so they're all over the map. So this student started just a couple of weeks ago. She's just implementing the eating plan, and just with the eating plan, she has noticed, she shared, I haven't needed to take my bladder pills for incontinence. So exciting. And that's what we notice. This eating plan is really, really powerful. Most of our students have a lot of bladder issues. And when you really greatly reduce the food to those infections, you notice that your bladder symptoms start to improve. And this is even before you start treating. The next student shared, I've adjusted my eating plan. So that's what we do in the academy, is that you learn the eating plan and you implement the best you can, and then you send me what you're eating and I give you feedback. And she had to make a few adjustments. And she shared that now since I've made the adjustments, my left foot is picking up better. So she's had an improvement in her drop foot just with the Live Disease-Free Eating Plan. And my energy continues to improve. Amazing. And that is the power of this eating plan. And I have a playlist on Live Disease Free YouTube on our YouTube channel. And you can go there and you can listen to what the eating plan is about and what I eat for breakfast, dinner, and supper, and start implementing and send me your successes even before you start treating. It's very important for successful treatment. The next student shared, I've been busy following the eating plan, and I've experienced the ability to participate better in running errands with my family. I'm not as fatigued and I'm dealing with less dizziness. I've been able to increase the amount of time that I'm able to exercise, both on the recumbent bike and the treadmill. Again, just the eating plan. So those are newer students, and this is another newer student too. My improvement has been in my ability to stand and drive. And also my stamina is much greater, and I'm having less fatigue, and I'm able to work on my elliptical 3 to 4 times a week for up to 30 minutes. So these are people prepping. They're prepping to treat those infections that have been causing disability in them. Another student is this one, a gentleman. He is on his either first or second treatment cycle. His balance is back. His numbness has greatly improved, and his neuropathy has also greatly improved. So those, again, are people that are just getting ready to treat. Now, this is a student who's had multiple sclerosis for, I think, about 30 years, and she has not been able to walk for 15 years. She is on her 7th treatment cycle. She has had so many improvements, and I'm going to be interviewing her very soon, and I'll be putting that up on YouTube. But the exciting thing is she keeps sending me updates. Her hand, she could not use it for years. She can now open and close it. She's able to stand for longer periods of time and also exercise. So she's taking back her mobility. I feel so great. My health continues to improve. I am stronger and I have less pain and rigidity. My legs and my feet no longer swell. They look and feel perfectly normal. Also, my hand and my feet never fall asleep. She used to have pain and kind of like a waffling pattern on her skin, on her thighs, which another student had too, and that is gone. That disappears. She is on her 7th treatment cycle. She's taking 3 antiparasitic drugs, and then she'll stop, and then she does antifungal treatment for at least 10 days, and then she takes a break. But on her break, she's also doing, throughout the whole time, she's exercising, but she's also using the herbs, like antimicrobial herbs. So it's not that we don't ever use them, because yes, they're helpful for candida and for small bacteria, but they're definitely not going to reach into the central nervous system, and they're not going to get rid of the bigger parasites, or we're dealing with these filarial worms, not just in our central nervous system, but also in our blood, and they move into the organs. They move all over the body. So this is really inspirational. She shared, I am reminding myself of my huge why. So the more disabled we are, the stronger the why we have to have. Why do we have to beat this? What is my life going to look like? What is my intention? And so she has a huge intention and a huge why. And that is how she's been able to continue to persevere. A couple more that I wanted to share with you, which is so amazing. Another student, not as disabled, found us, and that is such a huge thing, is if you can find us and if you can treat these infections as early as possible, early intervention, it's easier. It still takes work. It still takes time, but we have people like another student that I'm going to interview her actually next week that is symptom-free. She's back to working full-time. She's going back to school this fall. That's a different student, but she was able to do that in less than 6 months. I would say maybe by 4 months, she was completely symptom-free. She had to keep treating longer though. That is the key, is when we've had an infestation, we have to treat a few more cycles even after we are symptom-free, because there could still be eggs and they could still be hiding under biofilms. And we want to make sure that as they're hatching, that we get rid of the big burden of the eggs that are laying dormant, waiting to hatch. So this next student, as I mentioned, is not as disabled, and she's getting ready to treat, but she's already having some days where she's symptom-free. She's still going to have to treat, but she was actually able to go skiing because her ankle did not hurt. The last student I want to share with you is not an MS student. It's somebody who has, I'll just read her symptoms so you can understand. There are people who have such terrible gastrointestinal distress that they just can't eat anything, and they end up eating and following a carnivore diet. And that's what she had to do, because it didn't matter, even if she cut out all the carbs and she went down to a few vegetables, nothing agreed with her. It would give her extreme pain and extreme diarrhea. She had pain, spasticity, so no MS, but you can see that other people can have a lot of the symptoms that we have with neurological diseases. So she had pain, spasticity, numbness, weakness, bladder issues. Her mobility was impacted, poor digestion, fatigue, foggy head, unable to eat anything. And she was following a carnivore diet when she came to me because she was so desperate, like she didn't know what to do. And then she was also dealing with lots of skin issues and chest pain and strange nerve sensations everywhere in her body. So she started to follow not the eating plan. She went even stricter. Like some of the students, that when they start, they're not used to eating vegetables, and they're increasing the vegetables up to 9 to 13 servings a day. So they're changing their habits. This poor lady had to not only give up all the foods that she loved, but she couldn't eat vegetables either. But what she did is followed all the steps in the program, and she was only eating meat and the fat from meat. She was able to stabilize herself. So she was able to continue to function at work. And that's what the carnivore diet does for some people. So it's not that they want to follow that because they love other food. It's that that's the only thing that makes it so they can actually survive. So she started her first treatment cycle. She got tested and found out which treatments were good for her. And I'll share what she said, because this is really huge. So if you know anyone who's struggling and is kind of going towards a carnivore diet, this is the answer, is treating the parasites that are causing all the symptoms. So today is day 5 of treating. I took 3 days of the first parasite treatment, followed by the next parasite treatment. So, and with our students, we bring them in slowly, and she's absolutely fine. And she said, I have to tell you that I'm completely shocked at by how quickly the medications made a difference. After only 2 days on the first treatment, I sensed that there was definitely a shift, a dramatic shift. I was expecting to have completed a full treatment cycle, at least 1 or 2, before I would notice any improvements and even being able to introduce any new foods. But I noticed a dramatic shift in only 2 days. And whatever parasite was causing the endless diarrhea and pain, it is scared and dying. On the 3rd day, there was no mistake that something had changed, and I felt brave enough to try some pecans, and it was fine. Then I had a cup of mint tea, and that was totally fine. Like, can you imagine you can't even have a cup of tea? Then she had 2 eggs, and nothing happened. No diarrhea, no pain. And then she said, I feel amazing, and I've been so happy and effortlessly bouncy at work over the past few days in a way that I haven't been in a very long time. I can't tell you how excited I am to start a batch of raw sauerkraut. So she's making her own raw sauerkraut and begin to eat my own vegetables. Food variety is no longer a dream on the horizon, but it is here. I'm so happy to not be constrained to only eating a carnivore diet. I'm overjoyed and relieved. Wow, wow, wow. That is what this is all about. So if you're in a place where you're like, I was told there is no hope for me, there's nothing I can do, I've been going downhill for 5, 10, 15, 20 years, I'm here to tell you that no, there is an answer for you, but you have to take a different path. You have to treat infections. Infections are causing your symptoms. And although viruses can be more active, they've been trying to pin it on viruses for so many years. And as the MS Society said, there is no concrete research at this time linking MS to viruses. So don't wait for a magic vaccine. Don't wait for a magic pill cure. There never will be one. You can see that our students are using multiple parasite treatments. Sometimes they're using multiple fungal treatments to treat the fungus, and sometimes they have to treat Lyme also, and building back the good microbes using a holistic approach. And that is what's working for people. And that is what's getting people's lives back. There are so many well-meaning doctors, practitioners, etc., that are starting to venture into the integrative, or maybe they have for a few years. But the skill of treating parasites has been lost. It's a skill that we probably never totally understood how much humans can be infected, but it is definitely something that when I was a young girl on a farm, when I was really young, the doctor would deworm our whole family. Maybe more for pinworms, I don't know, but they would deworm. But this is something we don't do in the developed countries. This is not just North America. This would be Australia, New Zealand, all over Europe. If you're in a developed country, they are not treating parasites because they believe we don't get parasites in developed countries. Our pets do, and we don't necessarily, like, how is it that our pets can get parasites and we have to treat them, but we can't get parasites? And parasites come in through the produce that we buy from the stores. Maybe people are preparing our food and they don't wash their hands and they have parasites. Maybe we travel. Maybe we grew up on a farm, or we were on a farm like myself. Parasites are all around us. And I shared on a previous video that nematodes are roundworms. They are the most abundant animal in the world. 4 out of 5 animals in the world are nematodes. We are ignoring them and we're paying a high price for it. Most of us that are dealing with chronic disease have nematodes. Maybe other things too, but definitely nematodes. And they come up to like several feet long, down to the dot of a pen or even smaller. Please share this video with others. You can help us bring change. And if you're at the place where you're like, I need to learn more about this, watch the other videos in the series, The Cause of Multiple Sclerosis, watch my eating plan, watch my other videos, start to learn. And once you're at the place where you're ready to treat, make sure to watch my masterclass training and you can get started right away and join these amazing wellness champions in their recovery. Take care and bye-bye for now.